today, April 8th, 2025. Ms. McDonald, would you please call the roll?
Mayor Slanka.
Here.
Mr. Richmond. Ms. Simpson.
Here.
Ms. Baggett.
Here.
Dr. Zollett.
Here.
Ms. Lawley.
Here.
Mr. Bonnell.
Here.
Ms. Miller.
Here.
Thank you very much. And next item on the agenda is... Oh, I'm so sorry. Who's up for today? I'm sorry.
Mr. Richmond.
Okay. Is there a motion to excuse Mr. Richmond from the meeting today?
Sure.
Is there a second?
Second.
Wonderful, thank you. It's been properly moved and seconded. Is there any discussion? Seeing none, we proceed to vote. Ms. McDonald, please call the roll.
Ms. Simpson.
Here.
Ms. Baggett.
Here.
Dr. Zollett. Ms. Lawley.
Yes.
Mr. Bonnell. Ms. Miller.
Yes.
The yeses have it and the motion passes. Thank you. Next item on the agenda is citizen comments. Do we have anybody here today? I don't see anyone. We'll move forward. Next item on the agenda is the approval of the minutes. Do we have a motion to approve the minutes from March 2025?
So moved.
Thank you. Is there a second?
Second.
It has been properly moved and seconded. Is there any discussion on the minutes from March? Seeing none, we will proceed to vote. Ms. McDonald, please call the roll.
Ms. Simpson.
Here.
Ms. Baggett.
Here.
Dr. Zollett.
Yeah.
Ms. Lawley.
Yes.
Mr. Bonnell.
Yes.
Ms. Miller.
Yes.
The yeses have it and the motion passes. All right, next item on the agenda is our education presentation from Dr. Genowine. Oh, I'm so sorry. Oh, receive and finance, okay, I'm so sorry, gotcha, I was ahead of myself. Thank you very much, everybody, for keeping me in line.
She was excited.
I was thinking the exact same thing. You don't want to hear about Canada horse.
We're just keep it moving. The next item on the agenda, in the right order, is to receive and file a financial report from March of 2025. Is there a motion to approve?
So moved.
Is there a second?
Second.
It has been properly moved and seconded. Is there any discussion about the financial report from March? Anything else? No? Okay. All right, wonderful. Ms. McDonald, would you put us, hearing no comments, we will proceed to vote. Ms. McDonald, please call the roll.
Ms. Simpson.
Yes.
Ms. Baggett.
Yes.
Dr. Zollett.
Yes.
Ms. Lawley.
Yes.
Mr. Bonnell.
Yes.
Ms. Miller.
Yes.
As, yeses have it, the motion passes. We will now continue on to the next agenda item, which is our education presentation from Dr. Genowine.
Good morning.
Good morning.
It's exciting, so. Candida auris. You guys have been hearing me kind of comment on some, reporting ones and twos cases here in Middletown. Oh, no. Oh, that's better. So I thought we'd talk about it because the CDC just recently has made an alert about the spread and increased case counts of Candida auris in the United States. So Candida auris, we'll start while she's figuring this out. It's essentially a new species of fungus. Candida is the genus. Most of us have heard of Candida albicans, which is a very common fungal infection. Pretty benign, easily treated with either nystatin if it's topical, if it's a skin rash or irritation, or even diflucan, fluconazole. But it's pretty easy to treat. It's not very heat tolerant, so it really doesn't like being in our bodies because it's too warm. So it generally doesn't cause a whole lot of problem. And that's kind of the Candida family in general, until Candida auris popped up. So it's a new species of Candida affecting humans, first found in 2009 in Japan. From Japan, it spread to, well, I shouldn't say spread, but it was then found in South Korea and then across Asia, eventually the Middle East, Africa, South America, and in 2016 was first isolated in the United States. The biggest issue with Candida is it is drug resistant. So, as we were talking about fluconazole, the azole drug class, Candida is resistant to that drug class. It's also about 30% of these isolates are resistant to amphotericin B, which is kind of our big gun next step typically for more invasive fungal infections. It's gaining significant resistance to that as well. It's typically in patients that are hospitalized for a long period of time, particularly in ICUs or in long-term care facilities. In long-term care facilities that take care of ventilator patients, so they're really chronically ill, they're on a chronic ventilator, 10 times the number of cases of Candida auris in those as opposed to other long-term care facilities. So being immune compromised by comorbidities is really a risk factor for infection with this. It is not ubiquitous. Ubiquitous meaning it's kind of everywhere. Candida albicans is kind of everywhere. It's on the table, it's on our clothes, it's on our skin, but it really doesn't cause a problem. Candida auris is not. It's only in limited locations and findings, which is again typically these high-risk scenarios and locations. And it's transferred directly by contact. There has been some description of whether it's airborne as well. Most things are finding that they really don't think it is, but that is not 100% ruled out yet. So typical infections was all first discovered in ear infections. Again, kind of a warm location, moist location. Yeast typically likes moisture, but now it's becoming more of an issue with wound infections, urinary tract infections. We'll talk a little bit. Any of these lines and tubes we like to put in people who are severely ill and on the ICU are all just great mediums for Candida auris. So urinary tract infections, and then of course bloodstream infections, which is where the real danger comes. So risk factors are immune compromised. This does include anybody like on chemotherapy or agents that make medications that make them immune compromised, but for the most part, it's really people who are severely compromised because of other illnesses. So they're in the ICU, they have multi-organ issues, they're on ventilators. Those are really the high-risk individuals. Medical devices, these aren't like pacemakers that are inside, these are central lines going in through the skin into central veins to provide medication. Well, TPN's a big one because of the nutrition that's in there, the fungus loves that. Endotracheal tubes for mechanical ventilation, Foley catheters, so those kind of devices that create this outside-inside connection. Candida auris loves those things. Recent surgery is another risk factor, again, being in a hospital setting and having a wound. Advanced age, again, just kind of a decreased immune status is going to put you at risk there. And then, interestingly enough, antibiotic exposure. Not just antifungal, but significant antibiotic exposure is showing a link to having Candida auris. Symptoms are kind of typical of any other sepsis. So you're in the ICU, you've had multiple problems going on, start to get fevers, chills, lethargy, hypotension, shock essentially. So it can be quite difficult to, part of the problem with it and why it's been kind of slow to be found maybe is that it looks like so many other things. So it looks like a typical bacterial sepsis. Many of these people can have a concomitant bacterial infection, so physicians are kind of targeted away from looking for it even, and that's created a real problem for its diagnosis. Diagnosis typically has been through culture. So you do a swab, you test certain surfaces on the body or fluids and culture it, and then once you grow it, try to identify if it's Candida auris. The problem with that is it looks a lot like other Candida species, so it was commonly getting misdiagnosed for other Candida species until people really started looking specifically for auris as it become more of a problem. Now there's a much quicker PCR testing for it that can be done in the hospital. So instead of days for a culture, you're now looking at hours that can be done to diagnose it in time. And the key to diagnosis is once you find it, you have to do the sensitivity testing to find out what is it going to respond to because of its resistance. So you get treatment going as quickly as possible. So prevention, obviously hospital and nursing homes now are starting to try to screen at admission so that you know if someone's coming in having something done in certain situations, do they already have it? Colonization is possible, particularly the armpits, the nares, the groin, again, warmer, moist locations. So screening people at admission is key because if you know they have it, then you've got to put them in contact precautions where the nurses and contacts with the patient are wearing protective gear, using single-use medical equipment, whether that's disposable stethoscopes or blood pressure cuffs, things that are not going to get then spread on to the next patient. Disinfectants, of course, you got to be using disinfectants. The problem with Candida auris is the typical disinfectant used by hospitals, it's resistant to. So once you isolate it, you then have to use a different disinfectant that is specific and more potent for Candida auris. If you're using the typical hospital disinfectants, it won't kill it. So treatment, most cases are still susceptible to one of the three classes of antifungals. But multi-drug resistance is getting much more common. So again, getting resistant to the azoles, resistant to amphotericin B, and the echinocandins are kind of the newer class of antifungals, but somewhere between 5 and 10%, it's estimated right now, are even resistant to that. So you're getting strains of this that are resistant to all three current classes of antifungals. So the treatment regimen is now becoming, figuring that out. Are they? If they're not, use the one that they're sensitive to so we don't get more resistance. But if they are, you typically are using now a multi-drug treatment program, trying to hit it from every direction. And there is a brand new FDA-approved antifungal that is a new class unto itself that seems to be having quite effectiveness against Candida auris. And obviously the problem here is it's a 15 to 35% mortality rate. So if you're in an ICU and you're already sick and you're immune compromised and you get Candida, it's very problematic. Neonates, still pretty high. 10 to 15% of neonates that wind up with Candida auris do not make it through the infection. So this is CDC data looking at 2016 when it was first identified and how rapidly the growth just in the United States has occurred. This is through 2023. Last year we had just shy of 5,000 cases in the United States. Excuse me, 2023 we had just shy of 5,000. 2024 I could not find accurate data for the final count in 2024. But you can see it's climbing significantly. This is states as of the end of 2023 again. About 10,000 total cases in the 7 years, and it's in 40 of the 52 states. Again, talking about the warmer tolerance of it, you see that it really is avoiding the Northeast and the Northwest, perhaps because of and Alaska, of course, where temperatures are colder, in particular in the winter seasons. Ohio, as you see, is in the orange. That's in the 100 to 500 cases compared to some of the hot spots. Most of it being targeted to larger urban areas, as you see California, Illinois, New York, Texas, Florida. If you click the next slide, you'll see this is ODH data, where again, the concentrations are Cleveland and Cincinnati. A newer map that I found but couldn't integrate in because it was a live map shows Columbus significantly growing in those numbers as well. So it's hitting the bigger population centers that have the big ICUs, have the trauma centers, and are taking care of these multi-comorbid patients that are very sick. And then they kind of spread out by going home with it on them or infected by it and finding it in nursing homes or wherever, and then the populations are popping out further out from those major cities. And then if you look today, interestingly enough, it's kind of nice, the Butler County put in there the summary for the 5 years. Actually, as Candida auris, 2020 there were 0 cases in Butler County. 21, 1, 22, 13, 23, 37, and last year there were 57. So kind of mirroring the CDC data that it's kind of exponentially growing the number of cases in Butler County as well.
All right.
Questions?
Yes, I might have missed the screening, admission screen. MRSA used to do the NARES, the nasal. Did they do the same?
Yes. Swab the armpit and the groin, NARES, and see if anything grows on it.
Okay.
What's the NARES?
Or do the PCR if they've got it.
They usually, she said, what's NARES?
Yeah,
Oh, you know,
nostrils.
nostrils.
Oh, gotcha.
Swab your
They-
nostril.
Yeah.
It's a common place for MRSA to colonize, and again, common for Candida auris.
It's kind of scary. So if you are going to go to the hospital for a surgery, or if you know somebody who's getting chemotherapy, is there a way to advocate for yourself? Like could you ask for single-use equipment, or should people be asking about this?
Probably not.
Not at this point?
No, because you're gonna be a low-risk patient. You're not gonna be around the higher-risk patients. All hospitals are gonna have a set forth, infectious control program that is already taking this into account and trying to get ahead of it. So they're screening the high-risk people, or probably are starting to anyway, and you're not gonna fall into that category.
Okay, but if you know somebody perhaps who's going to a nursing home or a long-term
There's
facility.
nothing you can do.
Yeah, I think
Well,
that's
there's
the
nothing you can
problem.
do.
You can get tested.
Well,
So
but if
what?
you're getting tested
I meant like-
and you're colonized, that could be a problem for the person in the room next to you, but it's not really gonna.
Well, you had mentioned single-use equipment, so I was wondering if people just ask for for that if they're going to a nursing home.
You can always ask,
Yeah.
but, you know, expense at some point comes into the mix of medical care.
So you just basically have to hope for the best.
There you go.
But you're not wrong.
That is true on the individual basis, yes, that is true. But on the bigger system-wide base and the healthcare system being like, you know, Premier or the healthcare system of Ohio, it is the 40,000-foot level of trying to do the precautions, trying to be aware of it, having systems, looking for it and knowing that it's out there and catching it earlier and getting it treated so that it doesn't spread to the next one.
Don't go to a nursing home and don't go to a hospital.
Easy.
Yeah.
That's,
Well, you know
Nobody's
what?
doing that anyway.
Yeah, but what's funny
If
is
you
when.
do, go to Alaska.
But wait a minute, when I kept saying, what do you have against Canada? Because I kept hearing, okay.
Canada instantly has
I was
made the
thinking
same
like-
announcement that the CDC did, so it is in Canada as well.
Yeah, I was laughing though, because you kept talking about Canada. I'm like, is that why we want it to be a 51st
Yeah.
state?
Get away from Canada. or-
Yeah, right. But I was gonna say, really, we had a long time ago, I remember Sunny Hill was a mayor, and he sat on the board. And all the time during these reports, he would say, well, it's getting scary in here. It's getting scary when you hear all of this,
Yeah.
because health can be, all the different things that are out there can seem really scary, right? And it's just a lot of information to kind of encompass, but people are really on top of these things. And then some things, like you were saying, you just can't do anything about it. So that's when public health comes into play.
what are you
where we
talking
really
about? We're
need to
going
be-
backwards here in this
Well,
country.
okay,
I
we're
mean,
not,
we're-
we're talking about Public Health Week. And
No.
so, no, I'm saying, but that's why prevention is really important, right? You try to stay as healthy as possible, because you wanna prevent some of these boogeymen, you know, and women. I just won't put them. So anyway,
So
but
each
yeah.
week I get to it, but the scariest thing I read in here all the time is this thing with the measles thing around here.
I know.
I mean, I never dreamt, in this area, Springboro and Amanda, and that more kids are not vaccinated than are.
Mhm.
Well, that's insane.
Yeah.
Okay.
No, I don't think it's gotten that bad. There aren't more kids unvaccinated than are vaccinated.
In Middletown.
It
Vaccination
did, it
rates
said
are
in
still-
there, it said Amanda School, I think it said that, what?
76.
But statewide, we're still at above 85%. I mean, the vaccine rates are still high, but you're right, the numbers are dropping. And for a multitude of reasons, that can make it complicated.
Yeah. All right, any other questions for Dr. Genowine or the program? All right, hearing none, we will continue. Thank you, Doctor. And next item on the agenda is new business. The first thing we have is the travel authorization.
Yes, we have 2 travel requests. This is the Spring Ohio Public Health Conference. I will be going to the conference, and Chandra will be going, I think, one day, did you decide? One day to the conference. So it's usually Monday, Tuesday, and Wednesday. We finish up Wednesday, and Chandra will be coming Tuesday, I believe. Did you say Tuesday?
Yes.
That's it.
All right, well, thank you. So it looks like the total budget is $1,057. That's good. All right, so is there a motion to approve the travel authorization?
Yes.
And is there a second? It's been properly moved and seconded. Is there any discussion, further discussion? Hearing none, we will proceed to vote. Ms. McDonald, please call the roll.
Ms. Zipsey.
Yes.
Ms. Baggett.
Yes.
Dr. Zollett.
Yes.
Ms. Lawley.
Yes.
Mr. Bonnell.
Yes.
Ms. Miller.
Yes.
Thank you. The yeses have it. The motion passes. Next item on the agenda is the final reading and approval of our MBHE ordinance number 2025-01, which is allowing health commissioner to suspend a food service or retail food establishment's license. So we would need a motion, please, to read by title only first, and then the motion to approve later. So to read by motion, or title only first, please,
So moved.
and second?
Second.
All right, thank you very much. It has been properly moved and seconded. Is there any discussion? Hearing none, we will proceed to vote. Ms. McDonald, please call the roll.
Ms. Zipsey.
Yes.
Ms. Baggett.
Yes.
Dr. Zollett.
Yes.
Ms. Lawley.
Yes.
Mr. Bonnell.
Yes.
Ms. Miller.
Yes.
It has, yeses have it, it has been approved, the motion passes. Thank you, and the next item is the motion to approve, so first we'll go ahead and read, MBHE ordinance number 2025-01, an ordinance authorizing the health commissioner to take action that may be taken by the Board of Health as licensed or pursuant to Ohio Revised Code Section 3717.29D1 to suspend a license issued to a retail food establishment or Ohio Revised Code Section 3717.49 C1 to suspend a license issued to a food service operation. Is there a motion to approve?
So moved.
Is there a second?
Second.
It has been properly moved and seconded. Is there any discussion? Hearing none, we will proceed to vote. Ms. McDonald, please call the roll.
Ms. Zipsey,
Yes.
Ms. Baggett,
Yes.
Dr.
Yes.
Zollett, Ms. Lawley,
Yes.
Mr. Bonnell,
Yes.
Ms. Miller.
Yes.
Yeses have it, and the motion passes. Thank you. Next item on the agenda, again, the same thing, we'll move to read by title only and then to approve the final reading and approval of MBHE ordinance number 2025-02. Is there a motion to read by title only?
So moved.
Thank you. Is there a second?
Second.
It has been properly moved and seconded. Is there any discussion? Seeing none, we will proceed to vote. Ms. McDonald, please call the roll.
Ms. Zipsey,
Yes.
Ms. Baggett,
Yes.
Dr. Zollett,
Yes.
Ms. Lawley,
Yes.
Mr. Bonnell,
Yes.
Ms. Miller.
Yes.
Yeses have it, the motion passes. We'll now read the ordinance title, MBHE ordinance number 2025-02, an ordinance authorizing the health commissioner, any registered environmental health specialist or environmental health specialist in training employed by the Board of Health to take action that may be taken by the board as licensed or pursuant to Ohio Revised Code Section 3717.29 C1 in a retail food establishment or Ohio Revised Code Section 3717.49 B1 in a food service operation. Is there a motion to approve?
So moved.
Thank you. Is there a second?
Second.
It has been properly moved and seconded. Is there any discussion? Hearing none, we'll proceed to vote. Ms. McDonald, please call the roll.
Ms. Zipsey,
Yes.
Ms. Baggett,
Yes.
Dr. Zollett,
Yes.
Ms. Lawley,
Yes.
Mr. Bonnell,
Yes.
Ms. Miller.
Yes.
Thank you. The ayes have it, the motion passes. Next item is the approval of Resolution 2025-01. Let me go ahead and find it here. Okay, is there a motion, let me go ahead and read it. MBH Resolution Number 2025-01, a resolution authorizing the city's health commissioner to apply for, accept, and enter into a water pollution control loan fund agreement on behalf of the Middletown Board of Health for the repair and replacement of home sewage treatment systems and declaring an emergency. Is there a motion to approve?
So moved.
Thank you. Is there a second?
Second.
Has been properly moved and seconded. Is there any discussion?
Yeah,
Thank you.
we wanted to talk about this. Carla's gonna talk about it mainly. This is the first time we have went into, look at Carla looking at me like, really? This is the first time the health department has had this grant. This grant seems pretty complicated at first because we haven't done it before. And it's a lot of layers to what we have to do. And so we have a checklist. We're working really closely with Butler County. But this is the EPA grant, grant that gives money to municipalities for assistance in septics, whether we're replacing them, repairing them, etc. So financial assistance. But it's not as easy as here's your money and you can repair it. You have to go through bidding process. You have to identify the house. The house has to be owner occupied. Then you have to see what's wrong. So you go through a bidding process, and then you have to do soil samples. And I'm getting this all, just throwing it at you really quick, because you guys will get all of this in a checkoff when we receive the money. So you have to go into a soil sample and design piece and then you have to go into what's wrong with the septic. Then you have to send all this to them and they have to approve it, then you get it back, and then you have to, so it's a process. And we talked to Butler County, they said from start to finish, it could take 6 months for one house
To a year.
to a year. It just depends if it's a repair, if it's a replace, if the design is accepted, if the soil is accepted, so it's a process with it. And we won't receive the money, I think, until July. That's when they start releasing the money, so we can't start even putting all of this out to the public until then. But we'll try to have it as organized as possible. You have to go through each one. And what other things that can,
It's an income base.
and it's income-based, right? And so it's a great thing to try to offer to our citizens, to try to assist them in this process, but how clean it'll be and how long it'll take will depend, because if we have a hard winter, it'll be a lot of, can you think of anything else, Carla? Because we've been on the phone back and forth. Carla's been losing sleep over it. You can see how many pages it is here. So it's almost like, you want some money? Okay, let me give you some money. And so we will get back with you. The law department is trying to help us to see what you all have to approve. Do you approve every single contract every time we have them? So if that's the case, it could be a delay in waiting for the next Board of Health. Or do you we just don't know yet how we're gonna go through this, but we had to have a resolution, we had to have a sample, contract sent up to EPA by the 31st.
April 30th.
April 30th of this month, to even make sure we stay in line to get the money, the grant. And so this is coming to you. For some reason, if the money goes away, if it stops, it just stops. But we have a little time to do this. And so people will want the assistance and the help, but whether they're eligible or not, we have to just go through the whole process. And so we'll keep the board up on everything. And I think Butler County has a checkoff list where you can make sure you're doing all the layers of things to come in, because people have to get their soil sample, bring it in, then you send it up, you know what I mean? So it's just, we're making sure nothing falls through the cracks or whatever, but
Is the money already out there?
they
Is there
awarded
any way
us.
that you may not get the money with everything that's going on now?
Yeah, possibly, and this is a reimbursement, so we have to pay upfront, so
Oh,
that's,
and then,
yeah, so that's another thing too. Once we kinda get this approved by you guys, we'll have to go to the finance department so they can appropriate some money and a fund for us to spend out of, right? Because we have to pay the contractors and stuff first to get the job done, and then you send that. But they approve that job before we get started, but then we have to get everything done first, and so we'll make sure, I'm sure once we do it a couple of times, it'll be easier. Because, you know, when you verbally say steps of things, it sounds a lot more complicated, like you have to walk in the door, turn on the lights, you know. But, at first, we're just making sure that we dot our i's and cross our t's to make sure everything is complete. And then, of course, we'll have our own process here, because I think counties do it a little different. They have to go to the auditor and do stuff. We can do it a little quicker by our finance department being right next door to us and appropriating us the money. So we'll see how that works out. Anything else, Carla, when you're like,
Nope, that's it.
That's
The
pretty-
grant goes through,
Yeah.
if we receive, the
Mhm.
monies go through 26.
December
So,
26th?
20.
Mm.
how much, I think I saw it, but how
150.
much was involved?
150,000. And we said that, it sounds like a lot, but sometimes it could be 3 homes, 5 homes, yeah.
Yeah.
So it doesn't, you know, depending on what kind of systems they get replaced, or they get repaired, or what's going on, so.
Any
Do
other
we
que-
have properties identified that
Well,
we're
it'll
gonna
be
reach out to and say, hey,
Well, we will probably send out information in the designated areas that you're not aware of any failing, obvious failing septic systems at the current
yeah,
time. But we will definitely let them know that we have that. the
What
money's
happened
there.
to one fails?
What was your answer earlier when she said, what can you do about this?
Nothing.
Nothing?
Okay.
No, it does. No, we were laughing about that a little bit. When it fails, you wanna make sure that you're starting to rectify the problem, but you can't, if you fix the problem, it continues to fail. So often Carla makes them pump more often or do things like that and try to make sure it's, you have a better situation. But once you have a failing system, you gotta get it repaired or replaced, plain and simple. But you can probably pump more often and do things that reduces the.
But if you have a person that, has financial problems anyway, and they can't, they can stay there, what if they can't pump more? They can't pay more for it, or they can't, what do you do? Nothing?
I think that's what we're trying to get help and avoid, because the Board of Health would have to tell them to move.
Okay.
That's what the bottom line is, if you can't fix
That's
it.
the end all,
Yeah.
okay.
Within like a couple of days, right?
Well, usually, you can give them some time depending on how
think
bad is failing, but ultimately, you have to move because it causes a public health nuisance, imminent danger as far as putting that in there, so. Yeah, and that's why we're trying to kind of get ahead of the problem and rectify the problem, because we do have systems that are older. But we have good soil, so you really can't tell it's failing. I know, that's what we have that really good sandy soil that it kind of goes, so
It
anyway.
kind of leaches out.
Yeah, right. So, this is one of the things that the mayor has been helping us, with, trying to get some kind of resolution, kind of get ahead of this, issue a little bit, so we can kind of address it before it just
Mhm.
becomes that we have to do things fast, and then we have to put people out of their house. And if one person's in a house, it makes a difference than if it was a family of 5. I mean, so those are the kind of things you look at too, so.
And this is 100% reimbursed?
No. For who?
For the homeowner?
Homeowner.
It's income based, so
And
it
if-
I
depends,
see. It's
yeah,
just-
it's
okay.
yeah.
So it could
So
be
it's
100%.
different, it
but,
could be up
yeah,
to 100%,
Up to 100%,
yeah.
Mhm.
Well, it helps, so that's.
Yeah.
Mhm.
Any other discussion, questions, comments? Okay, hearing none, we will proceed to vote. Ms. McDonald, please call the roll.
Ms. Zipsey,
Yes.
Ms. Baggett,
Yes.
Dr. Zollett,
Yes.
Ms. Lawley,
Yes.
Mr. Bonnell,
Yes.
Ms. Miller.
Yes.
Yeses have it, the motion is approved. And the next item is the approval of the contract template. Let's see here, that's still, it's connected.
Mhm.
So here we go, let me find it really quickly. After I scroll through everything. So is there a motion to approve the contract template to repair, replace home sewage treatment systems under the WPCLF?
So moved.
Is there a second?
Second.
It has been properly moved and seconded. Is there any discussion on the contract thus far? Hearing none, we will proceed to vote. Ms. McDonald, please call the roll.
Ms. Zipsey,
Yes.
Ms. Baggett,
Yes.
Dr. Zollett,
Yes.
Ms. Lawley,
Yes.
Mr. Bonnell,
Yes.
Ms. Miller.
Yes.
Okay, the ayes have it, the motion passes. Thank you. Next item is, the last item on the agenda is the first quarter report of 2025.
Yes, we give you a quarterly report every year so you can compare the numbers, and it's pretty much just presented to the board. So it's not a voting process, it's just your quarterly report.
Is there any discussion? Anybody have any questions or comments about the first quarter report today? All right, hearing none, we will go ahead and proceed. That concludes new business. So the next item on the agenda are our reports. We'll begin with our Health Commissioner, Ms. Jackie Phillips Carter.
Thank you. We had, this is the week of Public Health Week, and we had a proclamation given to us last week by our mayor, so, and it was Mrs. Lawley and Ms. Baggett was at the meeting. It was a full night and a full house, so thank you. I saw you, you see me kind of waving at you up in the, and, I think Chandra will probably report on some of the activities, because we'll have a table available, but you have a wonderful, I always say this and I kind of get in trouble, but you have a wonderful public health staff. And I always look at public health as being the people, right? And our department are made up of people, and we have a lot of things going on in our department, which most people do. Life happens to everybody, but we have falling parents, we have kids being assessed, we have flooding in our camping areas, we have difficulties like that. I had my husband's daughter passed away. We have a lot of things going on. We have a wedding happening this month. You know how crazy people can get with weddings. And the staff has been wonderful. They're present, and working really hard. So I appreciate all the staff at Public Health Week, and I appreciate you for giving us the proclamation and you guys taking out the time to come. And public health is still a great place to work. And so prevention, prevention, prevention as we go forward. If we could just prevent things first, it's so much easier to deal with it, to prevent an illness than to start managing the illness. And so, and then I also yesterday had a person, a classmate that committed suicide. And so those are the kind of things, mental health, and Ms. Lawley will talk about what our Walk with the Doc is in May when we celebrate mental health. But people are struggling with mental health a lot too. And so we just don't know how that looks as we go forward and how it affects everybody, not only the people, the families that are really close to it, but just in the community as, at large. And so we have to be mindful that prevention is the key, and being patient and giving people grace and mercy. I always say that, grace and mercy. Somebody pulled out in front of me here and I'm like, okay. They could have came from the tax department or the jail or the courts. This building is not the nicest place to exit, so we always have to make sure we just kind of slow down and just smell the roses. And so I appreciate all of the staff, and I appreciate the Board of Health. It's really, it's nice to have the support, so that's, and I wanna really, I think, I'm trying to think, I'll stay with,
Can I say one
with
more
that.
thing about
Yes,
that?
yes, you may.
I wanted to say
One more
also
thing.
that proclamation was beautifully written, so the
Yes.
information that was given was excellent. And Mrs. Amy Skank, who wrote that out for everybody, that, it was wonderful, and a lot of good information. Do we have a copy of it in our, I don't see it. Can we have a copy of
Oh,
it
yes,
next time?
yes, yeah, and we
Yeah.
always hang our proclamations up on the wall in the health department too, if you ever wanna see the wall,
Yeah.
but we'll put it in the packet,
Yeah,
yes,
because it's
yeah.
just it's such good information about what public health can do and what it
Mhm.
has done and currently doing for our country and our residents, and it was wonderful.
Yeah, thank you, and you did a good job reading it.
I flubbed twice, really
No,
beautiful
the words were about this
Yeah, you did
time. If you saw those words on there, I said, oh, I'm glad we got a young mayor,
But thank you.
cause I would have been just ad-libbing. And you
go
know, the
roller skating.
birds, and the birds are beautiful.
Okay, thank you.
Yeah,
thank
no,
you.
you're good, you're good. I am going to bring up, I just wanted to mention to you guys, what is it called? Security paper for our birth and death have increased. The cost is gonna be increasing soon. And I mean, we paid $446 last year, and this year it goes up to $715. So I'm telling you this because we can incur that cost, but one of the health commissioners in Hamilton City contacted Butler County Health Commissioner and myself, and said, have we thought about increasing the fee? And so I said I would bring it up to the board, because the board approves all increases. And if we increase the fee, we always try to keep it the same for Butler County, right? Because we have statewide issuance, so you can go anywhere in the state for birth. But death, you would still have to come here, but people may start shopping to, around the.
What is this again? Explain
The,
it to
so
me.
it's when you get birth certificates or death certificates, it's their security paper that they're printed on. And so the paper is increasing. The cost of the paper.
So who pays this, the person that has the kid, or?
Yes, so when we receive the paper, the health department receives the security paper, and when somebody comes in for a birth certificate or a death certificate, it's printed on that paper, and it's $25, that's our fee now. And I think the state gets $13 of that, and we get $11 or something like that of that, whatever. That's the cost, the cost difference. If we raise the fee of a birth certificate or a death certificate, they're both $25 now, then the county would raise their fee and Hamilton would too. We would do it together if we do. I don't know if their boards are gonna do it, but she wanted us to bring it to our board to see it. It's terrible to do it without each other.
What was you said there was $400 and some and went to $700, what was that?
Yeah, that's the security paper, the cost of the paper to print them on.
Did it cost the city?
Yes,
I see.
yeah, it costs the health department our budget. Yeah.
So it's going up by quite a bit, and it's been $25, I'm sorry, go
I
ahead.
was gonna say, how many of those, if you come in and you need more than one death
If you need
certificate.
4,
you
it's
explain?
$100.
So it's $100.
If you need 4, if you need 8, it's $200, it's $25 a piece, yeah. And it's hard, we always try to take in consideration, the people, I have mine from North Dakota for 64 years, and it's on that foil black piece of paper, because my mom kept up with it and I kept up with it. But some people don't keep up with their birth certificates, they're transient, they move, they lose it, and it usually hurts the people, it's just a higher cost. And I don't know what the climate is, if we can increase the cost, $25 now, what would we increase it to, 30?
That's what I was wondering.
35, I don't know what they're suggesting, and that's a lot more money. And I know Jeff's department, Mr. Bunnell, the funeral homes, the cost there would be incurred for their clients there too, because that's, funeral homes did it, and then our citizens get it. And so I just didn't know, you don't have to decide now, but when this message came up, I told Amanda we need to bring it for the board to start thinking about it, because she just said, have you guys thought about increasing the cost since our paper is gonna start costing more? And I said, we'll take it to the board and let them kind of marinate over it and see, just think about that, because if they decide to raise theirs, we could keep ours the same. But most times, all three health departments try to stay in the same, you know what I mean, at the same
It's
level.
the same old thing, what happens if you can't afford that?
Yeah.
What do
Where's
you
this
do?
paper come from?
Yeah, that's what
I know, I checked with Amanda, I said, Amanda, can you find out why? And Amanda said more information's coming, but we can't find out why it's called, I think it's coming from a different vendor, the reason why it increased. Did you put this in the packet, or did
They
you?
got a tariff on it for
Yeah,
50%.
see right here, it went from 165 to 382
Per case.
per case.
Per
You know,
case,
yeah,
okay.
when you get them,
Oh.
so,
Well, then we need
That's
to
a
get it
pretty
here
big-
coming from somewhere else.
it's a
Well,
big jump.
kid, I don't know where it goes.
Maybe we can
Um,
find out. yeah.
Mhm. So we'll, if they get enough pushback, maybe they won't let us do that, but it sounds like it's gonna go,
It's going.
go through.
They've already
Yeah.
switched the vendor, they're gonna be delivering it in September, normally we get it in July, but they haven't given us any information. This was in one of those RVS, like OVRS meetings that we have weekly, and it was just a blurb in it, but they're gonna release more information in the coming weeks.
And normally I would have waited until we received more information, but the health commissioner in Hamilton's wondering, have we considered it? And so you guys need to start thinking about what we would do, what side you would land on, because you're the ones that raise the fees. You have to approve the fees. I mean, we wouldn't do this on our own. We have to bring it
And
to.
since
have
people
to.
can go to anywhere to get this, we
Mhm.
kinda wanna remain competitive.
Exactly.
With
Right.
neighboring counties
Right.
and stuff.
Yeah, and I think Warren County is 22 or something like that, so it's
Oh,
usually
really?
if you stay around it and people for convenience or whatever, that doesn't make a big difference, but when you get to 30, 35, if you, yeah,
Lose money.
right,
Yeah.
right. So just putting that on your radar. And then the only other things I have is we have a lot of good stuff going on, it's all in your packet. The health policy meeting, these are just, trash bash, and if you guys need any of these flyers, we have plenty of them.
April 26th, which is the same day as Earth Day, and the cleanup on the river, I believe, as well.
Yes.
So, there are two great things going on that day. Unfortunately, I won't be able to go to either one of them, but, yeah, if you were planning on doing either one, you can probably buy the other as well, and just check it out.
NAACP banquets coming up. I'm speaking at a couple of different events, that's in there. This is Infant Mortality Week. So for Black Health Week, it's one in Middletown, it's gonna be held at Rosa Parks, and it's one in Hamilton at, Booker T. Washington. It's just the week, so they have little atriums having something out there, so it's just different little
When's the
awareness weeks.
When's the Middletown one?
Same day, all of these are the April
Oh.
12th.
Oh.
Yeah,
what
so this
time?
one, I'm in Hamilton on this one, speaking at this one, but the one in Middletown at Rosa Parks is April
Okay,
12th as
got
well.
you. April 12th, at, from 9 to 2.
Yes, and that's in your packet as well. And this health policy is, and I don't know if you guys remember or not, but some of us got together, Visions Partner Prevention people, Safety Council, Mayor was there, Health Department was there. We talked to Thomas Hall about making it once a year that we get policymakers together to talk about the health of our community. This is the next one. It's in your packet as well. The next meeting will be May 12th, 9 to 11. And it's for people to come and listen to the current health affairs or whatever in Butler County. And this was designed so that our policymakers will know what's going on in their community when they vote on policy. So health boards, school boards, mayors, House representatives, anybody that makes decisions, and especially makes decisions on health, will be able to talk to health experts to see what the trends are at the time for Butler County. And then so right now, for instance, they were voting on this vaping thing. Well, they'll have the schools and people there can really talk about how vaping may be affecting the kids. So it's things like that, but this is the one once a year, and this is the next one, so it's in the pop.
And that was excellent last year. Did anybody get to go to last year? It was the first one,
Mhm.
last year, but it was an excellent time and being able to speak with other people, what they're dealing with as well, and what's really important to our residents, so we can actually make an answer for them.
It was a good networking opportunity for all the people that make those decisions. They were meeting each other for the first time or whatever, so it was really a nice event. So I think that's it. So it's a lot going on, and I think I think I'm finishing with that. Mayor, all right, I think I'm done.
Thank you very much.
Thank you.
Okay, next on our report is our medical director, Dr. Paula Genline.
We have the reportable illnesses for the month of March. Chlamydia, there were 23 cases. Gonorrhea, 5 cases. Hepatitis C, 4. Hepatitis B, 1. Carbapenemase producing organisms, there was 1. Syphilis, 1. And there was, again, another TB that we have not gotten a lot of information from Butler County from once again. And that is all the reportable illnesses.
Thank you, doctor. Any questions or comments? Okay, seeing none, we will continue. Next is our director of nursing, Ms. Chandra Corbin.
Like Jackie said, I'll be going to one day of the spring conference. Looks like it's got a lot of really good, kind of pertinent to nursing information being presented on that day. Our health fair planning is moving right along. We're hoping to get our save the dates out after our next meeting, which is next Thursday at the event center at 9:30, if anybody would like to join. Knock on wood, communicable diseases over the last couple of weeks have been pretty much on the low side. Our influenza hospitalizations have gone way down. We had an all-time high. If you look at the comparisons in quarters last year to this year, I think it said we had 60 hospitalized flu in the first quarter of last year, and we're over 100 this year. Thankfully, most of those folks were only in for a day or two for observation, but it's still a significant increase. And we are still waiting on, Butler County is still waiting on their notice of approval award for the 2025-26 PEP, Public Health Emergency Preparedness Grant. So when we hear more about that, I will make sure it gets into the packet.
Thank you. Are there any questions or comments? I had a question. I have something in my calendar and I don't have it with me, so forgive me, maybe we can get with you after this. But there's something coming up for health fair. Do we have a meeting like next Tuesday or
It's
Wednesday?
Thursday.
Oh, okay, I had it in my calendar for a different day.
It was originally on Wednesdays, the third Wednesdays, but the event center director, Angie, has a conflict on Wednesdays where she can't be in our meetings.
So
We
moving
need her
forward.
there, so we moved it today, so.
So moving forward will be on Thursdays?
It'll be on the third Thursday.
Okay, thank you. All right. Any other questions or comments? Nope, seeing none, we'll proceed. Environmental Health Director.
For the month of March, we received 3 plan reviews. One for a mobile, which was hooked fish and chicken. They're looking to have a mobile unit. Edie's, which is on Yankee, and End Zone Sports Bar, which is on Verity. Titus, excuse me, it's on Titus. We approved one plan for the month of March. It's Bismarck Donuts and Coffee, and that's on Elliott Drive. We've licensed 3 facilities this month. Inbox, which is a micro market, Starbucks, and the new Hibachi Grill, which is on Brill. We've had 3 change of ownerships during the relicensing period. Hector's is now Arcoto Divino, that is on Central, it's still a Mexican restaurant. Fresh's, which is on Suffin, and Blind Ernie's, which is a bar on Cincinnati Dayton. We're looking at working with 2 new owners, Frazier's, which is on Central, and that's in the Old Brent's location, and the Good Morning Wrap, and that is on Verity. If you know where the old Dutch Tavern was, they're looking to remodel that for a breakfast facility. We sent out all we sent out all our pool licenses, and those have to be in by April 30th. We received payments for all our food establishments and our tobacco facilities. We have about 70 tobacco facilities, so we received those for the month of March as well. We're continuing training on the new Acela program. We have 3 conference calls, at least 3 a week, and in April of next week, we have 5-day training, which is 4 hours each day. So, that's,
She's been grumpy.
yeah, it's a very different, very different, software than what we're currently using, so, yeah, we're all grumpy, including
Not all the
Amanda.
best.
Amanda's the only one that stays the same. Our sewage, we have 136 non-payments out, we're hand delivering, and we also send them out certified. So we're hoping to get those other payments in, if not 30 days after we hand deliver them, those payments will have to go on their taxes. And I think Jackie pretty much said everything with the Water Pollution Control Fund grant. The only thing is we'll send that to EPA, and if there are any changes in the contract that they think we need to make or the ordinance, we'll definitely have to make those changes. So I'll send those out, and hopefully they'll look at it and let us know if we need to make any changes, hopefully not. Other than that, that's all I have.
And the changes will come back to the board?
Yes, and the changes will have to come back to the board.
So that
And
would-
law, yeah.
Mhm.
That would be in May then, so that's fine after April 30th?
Yes,
Okay,
yes,
okay.
yes.
All right, thank you. Any other questions or comments? Hearing none, then we will proceed to the board member open discussion. Is there anything that any of the board members would like to discuss? Just anything at all? Things coming
Yeah.
up?
I just, question again. Do you know at all how any of this stuff is gonna affect you guys? Does this come from the state, or, I mean, I'm talking about, all these cuts, and they wanna cut money and everything. Does that come from the state or the feds to you, or how does that work?
All the above. We have one federal grant, which is the Workforce Development Grant. Remember, that's our biggest grant that we have, and so far, that one has not been touched. But we've had meetings, the health commissioners being we, with the state, as far as what has been cut and what we need to do about it. I think it's lawsuits and stuff still going on with a lot of different states, but in the meantime, the state said, it's like, that we need to get our invoices in and close up our reporting by the end of this week, so that state can report to the feds all of their grants to be decided what's gonna happen to some of the money. So they said that we have to just be prepared that if we're notified that some of our grants are affected, that we have to pause when they say pause, but then when they have an injunction or something, then we can move back and not pause and get stuff in as soon as possible. So, yes, it's affecting everybody, some more than others, some big health departments that have a lot of grants, federal grants, a lot of the STDs grants, HIV grants, community health worker grants. Those community health worker grants were, I guess, considered, sometimes they're DEI, you would think, because it's about African Americans and infant mortality in health. But a lot of the community health workers are rural grants, and they do on farms or Amish or whatever, but that's still a targeted, designated community that they're saying they go away. So a lot of people that have those grants, they said Franklin County and Jackson County were, they're 100% of their grants. Those counties are, like I said, high blood pressure and diabetes. They're targeting populations like that. So a lot of people are, so we're just taking it day by day, and ODH calls these emergency health commissioners meetings, and then the health commissioners meetings, we're saying, what are you doing? So they're they want us to send reports in or send stories in, if it's anything like these kids didn't get this or they didn't get that. But we don't know how it's gonna affect Medicaid, if it will affect Medicaid, and when we say Medicaid, a lot of people go automatically to poor, but Medicaid takes care of all
Yeah,
the nursing homes and kids and schools and FQHCs. So we just don't know. And so, we're just waiting to be, waiting to be told and stuff. We had a university person at Wright State that said campuses, enrollment's down and because of Pell Grants and that kind of stuff. So I think it kind of affects everybody differently. We are strong partners with Wright State. They do a lot of public health stuff with us, and so they sit in on the meetings sometimes. So we're just waiting and watching. Some people say it'll blow over, some people say it's serious, so we just really don't know. But the one that the health department has right now, I think Chandra and Carla, we looked at this, I think the only one that we,
Workforce effect.
was the workforce and FEP. And the FEP is the Public Health Emergency Grant. And sometimes those grants are, maybe taken away too. We had Ohio is, Middletown Connect. We received all of our money from Middletown Connect. And remember, Middletown Connect started getting other monies. And so right now, that initiative can carry on. Some private organizations, like foundations and Interact for Health, are giving these micro grants to fill in the gap of people that may be losing money. So people are coming forward that aren't governmental money, right? And so we'll just have to kind of wait and see. So that's where we are.
And there's no real timeline for
No wrong, yeah. So, Carla, you have a question? Look like you were thinking. But I think, so that's where we are with that.
Good question. I was also wondering about that as well. Just, there's not really much, we just have to keep getting updates.
It's like the
every
stock
month.
market, you gotta
Nothing you can
look and
do,
see
right?
what.
Just to sit there and watch it, huh?
Yeah.
That's why I said, like the stock market, I said, well, I had $1.50 and then now I got $1.20, and
Now
then
you
I
got
might get
75 cents.
$1.75. It's not my trillions that I'm losing. It's some of y'all, it's not mine. No, but it's just, I think it's important that prevention is about resilience too, right? You gotta swing with it and just make sure that, we do the best we can while we can do it until it happens. I'm not one of those that worry. I kinda try to wait until I have to deal with things, so.
It's just, there's all the costs. I mean, we said it here, to look at the cost of everything. I mean, everything you talk about.
Mhm. Yeah, I think that we have to be accustomed to change, right? And it's kinda hard sometimes to change, but hopefully we get better as we learn through the change. And so that's where I am with that.
I'm wondering also, maybe one of the things at the health fair, I know we're gonna have mental health fair, but because of so much, there's a phrase, living gracefully with uncertainty, right?
Mhm,
And there's
mhm.
so much uncertainty right now, and people have problems with change and with uncertainty.
Absolutely.
So I feel like maybe this mental health look to maybe help people deal with like uncertainty might be something we look at for the.
I think that's a good idea. I know that I was gonna give Ruth to talk about the Walk with the Docs that are coming up this month and the next month. But uncertainty that was a big thing that we were dealing with COVID, you guys. COVID, it was a whole lot of unknown.
Yeah.
And that's hard on everybody. And everybody's trying to make good decisions. People are taking advantage of the situations. You always have those opportunities. And so you're right, we can get some people in there. And what does that look like, right? Because if we're gonna stay at this world of uncertainties where things are not like they used to be, then how does that look? And what does it look like?
And have to
You know?
be internally be okay with that,
Yeah.
keep stress levels down, anxiety down as much as we can. Like you talk about prevention, walking, outdoor air,
Mhm.
whatever it is individually.
Right. How
Staying
to-
off
yeah.
devices, whatever. it
Staying
might
off,
be.
yeah, really start, controlling what you can control, but.
Yeah, you were gonna.
Oh, yeah, so Walk with a Dog for this month, is the 19th, and I do have handouts for everybody. Jackie will be our guest speaker. Yeah, it's right before Earth Day, so we're kind of focusing on Earth Day, so I will have trash bags and gloves, so we can pick up some trash along the way.
Yay.
But, she'll be talking about, the environment and just, clean water, clean air, what you can do. There's certain things within our control and some things are out of our control, so she'll be giving tips on that. And then May, I've lined up, per the request of some of our friends at Middletown Connect, mental health speaker. We'll have a provider there, to address adult mental health and adolescent mental health. 2 different speakers, and potentially their therapy dog will be joining us as well. I haven't confirmed that completely yet. So, please, if you guys can come out, we're really trying to build it up. We're back outside, we're not at the Y, we're not indoors anymore. So that'll be good, fresh air. It's only an hour, it's at 9 AM, Dr. Zala, so I don't wanna hear that it's so early. That your retired self can't get out. If you wanna take
9's
one-
better than 7:30.
I love it, your
Barely.
retired self.
Yeah. So, yeah, and if you guys can hang that up wherever you're at, or Dr. Zollett, please take one and pass it on.
Oh.
And put a reminder on your phone, hang it on your fridge. fridge whenever you're.
They'll come pick you up, it's all good.
Yeah, if you call, I'll pick you up. I get there earlier though, so.
Last time, talk about our residents that were there, it was,
Oh, yeah, so I think I mentioned this at the last meeting, I connected with the doctor at UC Hospital. He oversees the residency program there. He came to our last walk along with a couple of his residents, just to see what it was all about. And I did send them a list of topics for the rest of the year. I'm waiting to hear back from them, so we're gonna try to assign residents to, talk at some of our future walks. So it's about the residents in the hospital connecting with people that they're potentially going to be seeing in the hospital, hopefully not, right, because it's about prevention, but making those community connections, and hopefully people get a little more comfortable with talking with physicians and stuff too, so that you feel more, I don't know, I think, no offense to the doctors in the room, but we put them on a pedestal, they're humans too, you know, so, I've always just tried to interact with physicians like they're human beings, because they are, we all are, so hopefully it makes people more, I think, I mean, hopefully it makes people a little more comfortable to just be open and.
the speaker talked about colon cancer.
Oh, that's right, yeah,
Yeah,
yeah.
and she was 33.
Yes.
One time, it was a doctor that she said, I think something's wrong, so she
Yeah.
kind of.
And she was not a
She was
physician,
good,
I'll
yeah.
just point
She
that
wasn't a
out there. She
physician.
works for UC Health,
Mhm.
like practice manager and
Right.
coordinator of the program. But she came as somebody who survived colon cancer at such an early age.
Yeah.
A female colon
Yeah.
cancer survivor.
Mhm.
I think we
African-American.
associate it with males a lot,
Right,
but.
African-American,
Yeah.
but we loved it. One time, she insisted to her doctor.
Yeah.
She stayed a partner and didn't get mad at him, but she said something's wrong. Another time, she kind of ignored the second doctor when he said, maybe we'll check it. So she was 33 and 37
Yeah.
with colon cancer, and it was aggressive kind.
Yeah.
And so one time she was like, oh, I'm okay. But so she was saying it's time to lean in when you really listen to your body. And it's a time that the doctor says, no, I really want to do this. And he found what she thought was like a hemorrhoid, but
Yeah.
it was a mass. And so that's why partnering with your doctor, not saying that you're wrong and going somewhere, but just having that partner and them getting to know you and say, I really think, and they listened. So it was both of them, and so.
Yeah,
it was-
and we
yeah.
really should look at it
It's
as
really
a
nice.
partnership, right? And then, yeah.
I argue
It was
with
a
mine
good-
all the time, and
But-
don't
You
win.
know what I say.
Don't win, that's what he said, just do what I say. Just take this and do what I say. But anyway, we had a lot of fun then, but it was four
Oh,
of
yeah.
them, they walked, and they went an extra mile, I think,
They
around.
did, they were show-offs.
Yeah. So we had a good time.
But yeah.
Wonderful. All right, any other comments or discussion for the board, open discussion? All right, hearing none, then at 8:32, we'll go ahead and adjourn this meeting, and the next Board of Health is scheduled for May 13th, 2025 at 7:30 a.m. Thank you.